You'll need formula, a feeding syringe, and water for flushing. Once you've assembled your materials, follow these steps. Wash your hands. Remove the cap from your child's G-tube. If there is a rubber band in place, remove it at this time. Then attach the syringe to the tube. Pour the formula into the syringe and hold the extension set at the level of the child's stomach. If your child's appliance has a clamp, open the clamp now. Raise the syringe until the formula flow slowly increases. If needed, lower the syringe to decrease the flow. Formula should go in over 15 to 20 minutes. The formula may come back into the syringe if the child is fussy or crying. Just wait a few minutes. The formula will go in again once the child calms down. When the feeding is complete, flush the tubing with 5 to 10 milliliters of water. Clamp the tube, then disconnect the syringe and replace the cap, and if needed, the rubber band. Wash supplies with soap and water. Rinse and allow to air dry. You may reuse your supplies, so you want to make sure they're clean and ready for the next feeding. Feedings delivered through a mechanical feeding pump can be continuous during the day or night, or they may run over several hours. To deliver a feeding using a mechanical pump, assemble your supplies first. You'll need a feeding pump, tubing or bags, formula, feeding syringe without plunger, and water for flushing. Once you've assembled your supplies, follow these steps. Wash your hands. Pour the amount of formula needed into the feeding bag. Open the clamps of the feeding bag. Fill the tubing with formula. This is called priming. Then close the clamps when the formula reaches the end of the tubing. Place the pump tubing into the pump and then attach the tube after removing the cap or rubber band. Open the clamp on the gastrotomy tube and pump tubing. Check the rate of the pump. Start the feeding pump. The feed will then run over however many hours you have been instructed. Please note, depending on the type of pump that has been ordered for your child, it may look different than the pump in this video. Even so, it will operate the same way. Your home health company will go over your pump with you. Clamp tube set at the end of the feeding. Turn off the pump. Remove the pump tubing from the tube and attach the feeding syringe to the tube. Pour 5 to 10 milliliters of water in the syringe. Open the tube clamp if present and allow water to flow in, and then clamp the tube. Finally, place cap or rubber band on the tube. In order to prevent pulling on the tube during feedings, you'll need to tape the tube. Before you get started, assemble your supplies. You'll need scissors, skin wipes or skin prep, a washcloth, and tape ordered through Home Health. Once you have assembled your supplies, follow these steps. Wash your hands. Clean and dry the area on your child's abdomen where you will tape the G-tube. Wipe a skin prep pad on the skin where the tape will go. If your child's skin is irritated, your surgery team may order a special dressing, known as Duoderm. You can place the Duoderm on your child's skin and then tape the extension set to the Duoderm dressing. After the skin prep gets sticky, lay the tubing on the skin prep and cover with tape. Remember to move to different spots in order to help prevent skin breakdown.